Hello and welcome to the next lecture, lecture number 35, and in fact it is another tutorial. So, in the colonial context, the role of non-state players was very significant and it was very commendable. So, the reasons for the prominent place of philanthropy and private contributions may not be all very endearing or due to very noble reasons or altruism. In fact, the very starting point itself is not that very noble reason. So, in fact, one of the main reasons for all of this was the reluctance of the colonial state, clear negative attitude with regard to spending, and then claiming to promote the British model of volunteerism in India. So, in any case, whatever the intention, whatever the shortcoming, this gave an opportunity for the local elite to show their munificence. And again, here in all cases, it was not entirely due to pure altruism. So, some of it was also born out of the desire to just be in the good books of the colonial establishment or earn their certificates as very responsible, very participative, public spirited subjects, or just to be seen by the colonial masters that they are also following on some of the very noble examples set by the British, which the British very much relished, being seen as kind of beacons bringing light, reason, high culture to the colonized. So, behind there's all the smoke screen behind the crass commercial profiteering activities. And another kind of support in the colonial context was from the commercial agencies, which were not charitable contributions, but with very clearly stated goals and expectations, so from various industries. But nevertheless, it was a welcome and additional source and support given the government's stance of studied reluctance. So, we have already seen during the course of the main lectures how the mining lobby had its role in establishing the Liverpool School of tropical medicine, because the findings of the school, the researches of the school would help some of the health problems related to laborers and therefore directly connected to the profitability of the industry. Similarly, how the tea planting community supported Ronald Raw's survey, especially in southern India, and how Kala's research was also supported by the tea plantation industry. So, in a sense, that kind of self interest or commercial interest is good for research. So, not only because they give the funding for whatever expectations they had, but it was also by way of tuning the research community to particular areas, to particular problems. So, they were also giving freely research problems. So, sometimes research community has all the enthusiasm, they have the facilities, but they also want research problems to work on. So, this came very readily supplied, and apart from also giving the money to solve the problem. But this raises the question about the commercial direction, orientation that research can take. So, there is a danger of the imbalance or bias with more and more research going to study specific problems faced by these kinds of industries and commercial interests, and not to general problems faced by people at large. Of course, on the one hand, so public agencies and governments may, as part of their responsibility and as custodians of public fund, so they would fund those kinds of other kinds of researches to the general problems which we stated above. That what can happen is that if private and commercial agencies with their money are providing baits, BIT as baits, with better offers and incentives, so then there is a danger of greater interest going towards those kinds of areas, because scientists also being human beings would be inclined, tempted to follow those baits unless they are very committed about what kind of work they will do, irrespective of how much money comes for what field. So, of course, in the colonial case, so there was no room for these kinds of moral dilemmas. So, given the fact that the state was not too obliged about those kinds of researches of common public interest. So, the question does not arise. The choice is very easy. But that's not the case in the case of post-colonial independent countries, where that kind of indifference cannot be entertained, but still it can happen even in the absence of colonialism, where countries are independent with their own self-government, but then governments which are self-governments but selfish governments with selfish individuals, or governments which are not entirely democratic, or which are democratic in name but not in practice, or in some cases where the governments are generally democratic but may act in non-transparent ways in some areas and questions, where finance funding may be disproportionately allotted to areas which may actually be of special interest to some particular individuals who are close to the establishment, or some groups which are close to the establishment. Therefore, funding say particular areas, chosen areas, irrespective of how very relevant the area is, or how very immediately it is important, either in terms of direct or indirect gains, and also the money which could also have been otherwise used for purposes which are more direct. And then it can also happen in other ways. So, for instance, multinational companies funded research, or multinational companies forcing governments to embark on particular kinds of researches, especially kinds of researches which they wouldn't do in the original home country, because public opinion would not allow it, or there may be other kinds of issues like pollution and all that. So, those kinds of things can very well be experimented with. Then especially former colonies, the so-called third world countries. So, even in the absence of colonialism, this kind of culture can happen. So, coming to the role of the government, so as I said, the post colonial state need not and cannot have the same attitude as the colonial one, as public health has to be one of the top priorities of any government which claims to be the government ruling in the name of the people. And interestingly, the in the Indian case, the erstwhile colonizer Britain itself continued to provide a model of the important place of the state. In fact, actually, it was more pronounced in the context of the post Second World War period, and precisely the period coinciding with colonization. So, where the state was veering towards more of a welfare state, and particularly in the domain of healthcare. So, there was a clear move from the original voluntarism bias to more state involvement, as seen very forcefully in the NHS, the National Health Service, which continues to this day. Of course, it has its own problems, but it's very much there. So, which also means an ideology or philosophy of the state involvement. So, coming to the Indian case, the post-colonial situation, the post-colonial state, both at the national as well as the state levels, has from the dawn of independence shown clear commitment towards public health infrastructure, though the quality of it and the reach might have had and still continue to have much to be desired and to be improved. So, the good work of the state through research promoting organizations like the Indian Council for Medical Research, or premier institutions like the AIIMS, All India Institute of Medical Sciences, at the central level, and a whole lot of government funded state medical colleges across different states, with some of the states like, say, for instance, the present state of Tamil Nadu in this part of the world doing better on this count than some other states. While all this is happening in the post-colonial situation, there is always the danger of attraction towards other kinds of models where the state may withdraw, or kinds of models which are veering towards more private corporate hospitals. So, on the one hand, of course, there are clear advantages. So, for instance, so as we see in India, especially in many metropolitan cities and in many towns as well. So, these private corporate hospitals provide world-class facilities, the latest available anywhere in the world, which is made possible because of the kinds of money they are making, and also they contribute to this emerging and vibrant field of medical tourism. So, many of these corporate hospitals are very eagerly sought by cash-rich people, especially petrodollars are invited. So, many from the Middle East stream to to many of these corporate hospitals, and even others rich from neighboring countries, and even from Western countries, because of the same kind of treatment you get it at a fraction of the cost here, and at the same time you also get to see the country, its beaches and mountains and hill stations, its deserts and whatnot. So, that those kinds of advantages are there. So, while these are welcome from a larger commercial and even from medical delivery point of view, they can still only cater to those who can afford that kind of money. So, either within the country or those coming from outside, and therefore the state cannot absolve itself of its responsibility or vacate the space too much. So, because it needs to guard the interest of the larger, wider population who cannot afford and whom the state cannot neglect, as the colonial states could do, and in fact did do. So, therefore, the state has to be not only involved, but also try as much as possible to provide somewhere near the same levels of healthcare delivery as in corporate hospitals. So, in fact, many governments do constantly endeavor in very innovative ways, and with also schemes like what in Tamil Nadu is called Veedu Thedi Maruthuvam, that is medical care at your doorstep. And also, so it was very glaring when the COVID pandemic came. So, which sector played the more prominent role? So, the visible, valuable place of the public sector was one of the spin-offs, one of the good things that was manifested during COVID, in the midst of all the sufferings and turmoil. And one other domain where private players have also increasingly been entering is, again with some good, but probably with more harm, is the field of medical education. So, here again, like some of the hospitals which provide high quality sophisticated services. So, some of them, these medical colleges or training institutes do produce good students, doctors with the highest quality of training, but some of them have just sprung up to capitalize on the fact that in a country like India, with its population and its growing population, will always have a perennial need for healthcare, so which the state cannot fully itself cater to. So both in terms of the medical service, the health service, as well as the creation of the personnel for that. So that's where she has. So we are talking about the state's limitations. So of course, as I said, state has got premier institutions like Armed Forces Medical College or AIMS, and so many state level colleges, some of which date from the colonial times, like Calcutta Madras Medical College, doing commendable professional training. But then, given the number of doctors needed, the state itself in this field also, like medical service itself, the state itself cannot start so many medical colleges. So some of them have sprung up just making use of that situation and as a source of profiteering. So that itself is a market. This medical education has become a huge market with large capitation fees and regular fees, but not necessarily having a good quality medical faculty. So just as you can produce medical colleges and doctors, the kind of a mass production, you can't produce high quality medical faculty, because most of these people who are produced anyway, they will become doctors. That's the aim, to make money after becoming doctors. So they are not going to go further on to postgraduate and research work and to become faculty, medical faculty, which is a more difficult job and a more long run process. So many of these medical colleges, like the engineering colleges, so they have as their faculty students who are just graduated. They finish MTech just now, and then they become the faculty of the new engineering colleges. Similarly, so people with very minimum, so the MBBS or at the most MD will become faculty, and sometimes produced by the same college with its own limited quality faculty. So what happens is, so these end up producing a whole lot of mediocre medical graduates. So students who just had so much money to pay their way into such colleges, and this can have huge consequences, adverse consequences to the public at large, especially with an interesting combination involving the other sister concerns of the medical practice, like the pharmaceutical and insurance industries. Of course, we have to be clear, because we should not be judging, passing judgments, sweeping judgments. So these have crucial places. So they, with their fruitful and innovative practices and research investments, so they have a lot to contribute. So that has to be acknowledged. But in some cases, we see a very curious interplay and cross-fertilizing, one serving the other in terms of financial interest. So on the one hand, these medical students, so who are paid so much money as capitation fee and regular fees. So that's not a fee now, that is being seen as an investment. So they have put so many lakhs. So now there's always a constant challenge that has to be taken back. Returns on investment. So it's no longer a question of health and curing and all that. So it's now more of a business. So that investment has to be recovered. And pharma companies, so as we have been seeing in the news, especially the past 2 years and the past few decades, the kind of things that they involve themselves in, producing things which are not at all needed, and then they do all kinds of very innovative and zealous marketing, and you know who they target. So of course we are not blaming everyone, but these are things which we cannot deny. So things which are happening. And then, so of course, they also make a lot of investment in research, and they also have to take returns, and so they are not always scrupulous. And then, so there are all kinds of new equipments which are bought at great cost by the various hospitals. So very latest acquired MRI or all kinds of diagnostic instruments, or the very sophisticated blood testing equipments, laboratories set up in these sophisticated hospitals. So for everything, so you go with a headache. So these are things which all of us, many of us have experienced. For a simple headache, you may be asked to go through all kinds of tests, 13 tests, and for something in this, the entire body has to be tested, checkup. So that is something, complete health checkup. Or you, for some small issue, you take MRI. So whatever, because that instrument is there, because that also will get spoiled if you don't use it. So regularly, so there is a compulsion of having it regularly used, and then so that is a huge investment. Then again, there has to be a return on that investment. So the one hand, so those are all wonderful things. The fact that they are available, so you don't need to go like they say to some so-called first world country, Western world, to be able to avail of that facility. So on the one hand, it is good, but then the way it is used, they're all deployed. Then on the other hand, you have this insurance, which is another segment, sister industry. So the fact, the moment that the corporate hospital comes to know that your insurance, then the game is different. Everything is different. The entire billing, everything. So it all becomes double, triple. So, and this is how the insurance industry also grows on feeding on the fear of. So in many countries, you just have to take insurance. So you can't say like, I generally don't go to hospitals. I believe in naturopathy. So it's only once in a while I go to hospital. I may not need, but then the problem is once you fall, so you may not fall, but once you fall, especially it happens to students, because once you go to say a particular country abroad, you have to take medical insurance, which is actually not very cheap. But you might think that is one area where you can cut the cost, because normally, while in India you have not been to doctor or it's just minor, so you have your own homegrown remedies and all that. But then once something goes wrong, then you're gone. Then so that forces you to take, and that's how the insurance industry grows. But as I said, so these are all based on good principles, noble principles, but they can be misused, and especially with this kinds of things. So these doctors. So that's what. So it's a kind of alignment. Sometimes we even suspect whether there's also the food industry also is a part of this network. So you have all kinds of fast food industries. On the one hand, they produce a kinds of food which make sure that you have all kinds of diseases, starting from overweight to all kinds of diseases. Then on the other hand, you have a whole lot of these facilities, so including the gyms, for instance. So we suspect whether, so of course we are not getting into field of conspiracy theories, but we have to be careful. So how one feeds into the other. So on the one hand, you have people who make you fat, and the other, these are things which you are seeing in India. So 20 years back, we didn't see any gyms. Now every 100 feet, we have this gym, that gym, gyms for ladies, unisex gyms, all these things. So that is on the one hand. So that is keeping fit, which could be done by walking in your garden, in the beach, all that. But these are new industries, sister industries, more and more sister industries coming. So all because of this kind of, so on the one hand, the play of market, the coming of private players is good. But on the other hand, these kinds of diseases and this, so now we can talk of disease of commercialization. So of course I keep repeating, so we should not pass sweeping judgments. So there are genuine hospitals, corporate hospitals, some of them even started by some kind of social organizations, and very good doctors in the private sector. So we are not failing to recognize them, but we are also taking note of this kind of disease of commercialization, which is also pervaded in the nursing sector too. So here again, like the case of doctors, there is ever growing need for nurses. So we saw again during COVID. So the kinds of services that were done by, so that maybe that was for the first time many people saw the nurses also, because they sometimes they had to also come out in the open to protest. So anyways, so we all know. So in fact, so more than doctors, there's greater number of need for nurses. So therefore, there's a proliferation of nursing institutes, again with the same kind of charges, capitation fees and regular fees and all that. On the one hand, so this kind of proliferation is good, like, because in the colonial context we saw nursing had a kind of a stigma, which was seen associated with a particular caste or even particular religion, and all that. And so now it's notable even seen that much as a feminine profession. So we have so many male nurses, male students going to nursing colleges. So it has even, in fact, not only has the stigma been removed. So this is, in fact, if you can say that one of the important exports of India is the nursing professions, especially to the Middle East and even to European countries. So gone were the days when Europe trained nurses came here. So now Indian trained nurses are going, and especially even to Britain itself. But so of course that stigma is gone, but then again they are an exploited set of people. So especially with the meager pays, and as we saw in the colonial conditions, very bad working conditions. And of course, there are many fake unlicensed institutions which exploit less informed rural, semi-urban poor families, from which now again many of the students come. So as I said, so in this case also the government itself cannot be expected to create the rising number of personnel for either nurses, doctors, clinicians, or the infrastructure. But it's not enough that the government is not like the colonial state in terms of neglect and indifference. So the colonial state invited private contribution, but mostly, as we saw, in terms of financial support. But now there is a lot more private participation, where they are not just contributing, they are actually running the show. They are the players. So which means now there is a even greater role for government to ensure that this is by and large a fruitful process, where the best of commercial interests, the best of research, the best of healthcare, the best of insurance, all of those things come together. So government has to play a very active part, rather than what we can call here producing unhealthy trends. After all, we are talking about health, and this sector itself should not be beset with so much unfortunate unhealthy trends. So as long as that is taken care of, then this can be a very healthy and vibrant set of interactions in the healthy health sector. So on that note, we will close this tutorial. Thank you.